So, hello, my name is Bailey Vanderhoof, and this is my neonatal assessment for my maternity practicum. So the first thing I would have done is I'd probably already looked at my patient's chart to see how the birth went, how the labor and delivery went. I'm gonna knock on the door, I'm gonna gel my hands. Hello, my name is Bailey Vanderhoof. I'm your nurse today. Congratulations on delivering a beautiful, healthy baby girl. I'm here to do an assessment on your infant to make sure that she's healthy and that there's no complications or anything abnormal. Is this a convenient time for you? So if this is a convenient time, I'm gonna unswallow the baby and make sure that the baby is supine on the bed, in the bassinet actually. So first, I'm gonna assess the general appearance. So the general appearance appears to be pink, warm to the touch. There's some dark hair on the head, but that's okay. The baby is awake, they're not crying right now. They may possibly cry when I take this blanket off though, just due to the change of temperature. And I'm gonna note that the position of this infant is flexed. So I don't see any evidence of any distress, any illness, any breathing problems right now. So the first thing I'm gonna do is I'm gonna auscultate the breath sounds as well as count the respiratory rate by observing the abdomen, since I know that infants are they're belly breathers at first. So I'm gonna assess the respiratory rate for 1 whole minute with the bell of my stethoscope. I'm gonna assess the breath sounds on the apex and on the sides. So after auscultating breath sounds and counting the respiratory rate for 1 whole minute, I'm gonna note that there were clear and equal breath sounds bilaterally. I don't see any substernal retractions. The baby's respiratory rate was 40 breaths per minute, which is in the appropriate range of 30 to 60 breaths per minute. I don't see any signs of distress again. I'm also gonna note that I would be concerned if I heard grunting or if there were labored breathing or even possibly nasal flaring. So a respiratory rate can vary in an infant. It could vary if the infant is sleeping, or it could also vary if there's an infection. The heart rate might increase, or the respiratory rate might increase as they try to compensate. So the next thing I'm going to do is I'm going to assess the heart rate, specifically the point of maximal impulse, which is located at the lower left sternal border at the 4th intercostal space. So again, I'm going to listen to this for 1 whole minute. All right, so after listening for 1 whole minute, I'm going to notice that S1 and S2 are present. I don't hear any murmurs. With the lung sounds, I didn't hear any wheezing or stridor either. The heart rate is 130 beats per minute, which is normal because a normal heart rate is 120 to 160 beats per minute. Again, there were no murmurs or thrills, and everything appears to be normal. With the heart rate can also vary, so it could increase or decrease depending on the situation. If an infant is sleeping, their heart rate might decrease to about 80 beats per minute. If they're crying, it can go all the way up to like 180 beats per minute. Again, things like infection can also cause the heart rate to increase. So next, I'm going to assess the abdomen. So first, I'm going to note that I don't notice any redness, any swelling. I don't notice any lacerations. The skin on the abdomen is adequate for the ethnicity and everything appears to be symmetrical. I don't see any diastasis recti. I'm going to note that the umbilicus is midline. It's clamped. It's also a whitish color and it doesn't have any odor. So the skin around the umbilicus is clean and it's dry, which is appropriate for the newborn. So after I have inspected and looked at the abdomen, I am going to listen to the bowel sounds. I'm also going to note that the umbilical cord, I could see the 2 arteries in 1 vein. So now I'm going to auscultate bowel sounds in all 4 quadrants. Alrighty, so after auscultating all 4 quadrants, I'm going to note normal active bowel sounds in all 4 quadrants. Then I'm going to palpate the abdomen and all around. I'm going to note that I don't feel any masses. I don't feel any tenderness. The abdomen is soft, non-distended. It's dome-shaped. It's round, which is appropriate for the belly. So now I'm going to weigh. And do height measurements on the baby. So the baby weighs in at 7 pounds 6 ounces. They are 19 inches tall, or 19 centimeters tall, which is adequate for a newborn baby. The newborn baby is normally between 2,500 and 4,000 grams, which would equal around 5 to 9 pounds. And then the inches is normally 18 to 22 centimeters. So this baby is within the average. I would take the temperature in the axillary, which is going to be around 36.8 Celsius, which is also within normal parameters. For the head circumference, I'm going to measure around the baby's head, just above the eyebrows. So the head circumference here is 34 centimeters, which is within the range of 33 to 37 centimeters. And then I would assess around the chest. This is 32 centimeters, which is in range of 30 to 33 centimeters. So the baby is within adequate height, weight, and head and chest circumference. So starting again at the head seems to be the average circumference. It's appropriate proportion to the rest of the body. The head may be a little molded, which is okay because it just descended down the birth canal. It had to fit. That's a normal finding. Also, as I said, there's a little bit of hair on this baby, which is normal. I don't notice any sunken fontanelles when I look. There's nothing sunken, nothing bulging. There's no redness, swelling, lacerations, bleeding on the head. There's no bruising. And I'm going to assess for all of the suture lines. So then when I look at the face, I'm going to notice that the face is symmetrical. Everything is equally spaced, and there are some facial movements, especially like if the baby's crying, blinking, etc. So I would also, I'm going to look at the eyes. The eyes are symmetrical. I'm also going to make sure that the eyes line up with the tip of the ears, which is appropriate. I'm going to take my pen light and I'm going to assess for the reactivity to light. So I would note that the pupils are round and they are bilaterally equal to light. The color is going to be undefined and tears will not appear until 1 to 3 months. I also don't know any subjunctive hemorrhage. For the nose, it also appears to be symmetric and midline. I'm going to occlude one side of each of the nose to assess the patency. The infant did not sneeze, and after occluding, I will note that it is patent. There's no sign of any atresia. This is a normal finding. So now, for the mouth appears to be symmetrical. I don't know any cleft palate on them. The frenulum is not intact at this point, but that is a normal finding. So then I'm going to go to the infant's ears. So again, they are in line with the eyes. I don't notice any skin tags on them. There's no preauricular skin tags. So I'm going to push the ears. They're going to stay. They do not spring back. This is a normal finding. So now looking at the infant's neck, it's a little hard on the stuffed animal, but looking at the infant's neck, I'm also going to feel their clavicle. There's no presence of any lumps or tenderness as I hold the head. I don't know any crepitus. It's symmetrical and proportional to the body as well. There's no tenderness, and that's it. So now when I go to the chest, again, the chest circumference was within a normal range and is proportional to the body. Since it's a female, I note that the breast tissue is adequate and the areola is full. They're equally aligned on the baby's chest. I don't note any redness, rashes, anything anywhere. So now I don't see any going down. I'm gonna note the genitals. So I don't see any birth trauma at the genitals. There's no redness or swelling. I don't know any vaginal tags as well. There's no weird discharge coming from the baby, which is good. I'm gonna palpate the femoral pulses, which is kind of found in the inguinal. So now I could note that the femoral pulses are present and strong, probably around a 2+. The overall appearance, again, is normal. So the next thing I'm going to do is I'm going to assess extremities. So looking at the upper and lower extremities, they both seem to be proportional and the same size. I'm going to assess the brachial pulse on each arm, which also seems to be 2+ and strong. I don't see any abnormalities. I don't see any polydactyly, which would be multiple fingers or toes. And I also don't see syndactyly, which would be like a webbing of the toes or the fingers. I don't see any of that, which is great. I note that the hips are also not dislocated by doing like the Ortolani maneuver and stuff. I would note that they are not dislocated. I'm also going to look at the hands to note the single crease in both hands, which is appropriate. So then I'm also going to note that I would turn the patient over and I'm going to look at their butt and their rectum. I don't see any redness, swelling. Everything appears to be symmetrical. The baby has already passed their first meconium at this point. It was the correct color and consistency. There was nothing abnormal about the stool, and I didn't see a dimple on their butt. I also am gonna check their reflexes. So the Moro reflex, I would lift them up a little bit, their body, their arms would be extended. For the sucking reflex, I would put my finger in their mouth and they would suck on it appropriately. For the rooting reflex, I'm going to place one finger on the side on their cheek and they would turn toward me. They would turn to that side. And then I'm going to check the palmar grasp. So I'm going to put my finger in their hand. They're going to close their hand on it. And then I also would assess for the toes. So if I put my finger on their toes are going to curl up on it. So then that's the palmar grasp and the plantar grasp. And then I would also assess the Babinski reflex. So I'm going to stroke their foot. And as I stroke their foot from the heel up, their toes are going to spread out. So I would note a positive Babinski reflex. So then for activity, the infant is calm. If it's normal, they're occasionally crying. The crying is high-pitched and loud. It's not soft, so this is a normal finding in an infant. The infant was able, from what I know, the infant was able to see, hear, and feel. When I unwrapped the blanket, they felt the temperature. Was cold. With the light, the baby's eyes moved, so they reacted to the light appropriately. And then the baby also turned their head to voices. So that would be sensory for the baby. So that concludes my assessment of a head to toe in a newborn. For the S-bar, because I didn't do it for the maternal, Mrs. M is a G2P1, 38-year-old female who was admitted to the labor and delivery unit at 5:50 a.m. and delivered a healthy baby girl at 8:30 a.m. with weighing 7 pounds, 6 ounces, and 19 inches long. The baby's initial APGAR score was 8 and 9 respectively at 1 and 5 minutes. The mother and baby are currently stable with appropriate vital signs. The mother's background includes no complications. with previous births, and she breastfed her child for 18 months. She plans to do the same with this baby. There is no history of gestational diabetes, high blood pressure, preeclampsia, no complications in the first birth. There also were no complications in this birth. She's never had an episiotomy. She currently has normal vital signs. Her temperature is 98.6 degrees Fahrenheit. Her respiratory rate is 16. Heart rate is 86. Blood pressure is 126/72. Her oxygen is 99% on room air. As I went over with the baby, the auxiliary temp was 36.8. The respiratory rate was 40 breaths per minute. The heart rate was 130 beats per minute. You do not check the blood pressure in the baby at this young, and their oxygen saturation is 99% on room air. So after the labor and during the delivery, there was no significant bleeding. Upon assessment, there's no signs of any hemorrhaging or significant bleeding. The mother and baby is stable, and all of the assessment findings for both the mother and baby were normal. I recommend that the mother and baby are continuously reassessed, and that the mother is observed currently breastfeeding to make sure that there are no complications, no difficulties breastfeeding, and that everything is appropriate. I suggest that the mother be educated on breastfeeding, having 2 children at home, how the first baby, if the first baby is done being breastfed, that they could revert to wanting to be breastfed with this newborn home. I would assess the mother's knowledge on going home with two babies, and I would answer any questions that she has before she's discharged from the hospital. So with that, I conclude my neonatal head-to-toe assessment.